Hello, friends. Maria Trusa, the CEO of Fort Maine Medical Center. I am here for you every week, as I mentioned. I am going to bring a topic of importance for all of you to know. And today, we're actually making this a little bit personal. I have with me my niece, Stephanie, and we're going to be talking about the test, the genetic testing for cancer, which I actually had mentioned in other videos that I've done. But this is such an important topic that I actually wanted to, Stephanie volunteer, which I am extremely honored that she is opening her heart to you guys, to our audience, to talk about something very personal, because Stephanie actually had the gene test and it tested positive. And I'm going to stop talking, and I'm actually going to ask Stephanie to talk about your family history and the reason you actually decided to do this test.
Yes, so I come from an extensive family history of cancer, starting from my grandfather, great aunts and great uncles have all passed away of either pancreatic cancer, breast cancer, or ovarian cancer, all at young ages. What triggered my family to get tested was the early diagnosis of my aunt at 40 years old with stage 3 breast cancer. When she was diagnosed, the doctors recommended for the family to get tested because they said your family history is just too extensive. This is not just luck. This is not just you getting cancer. There's an underlying cause. So the siblings, 6 siblings, got tested, and 4 are positive and carriers of this gene. What this means is you are at a much higher rate of getting pancreatic, ovarian, or breast cancer. This is the BRCA2 gene. Once again, it's a scary thing to find out, but it has so much positive things. I mean, as they say, knowledge is power, right? Knowing that I am positive has allowed me to now take extra good care of myself, along with my doctors. So I go under extensive screening. The average woman would start mammograms at 30. I started them at 25, and that would be on a yearly basis. Once I tested positive, my doctor has now increased that to every 3 months I'm going through some type of screening, either a mammogram, a sonogram, or an MRI. And what that means is there's really not much time in between the test for anything to really be aggressive.
Right.
So if God forbid I do get cancer, I will detect it very early on, where I wouldn't need aggressive chemo or major surgeries. So the importance of this is extraordinary, and not only for me, but I have 3 children. So what does that mean? My children are 50% at risk of being carriers of this gene.
Wow.
So with that being said, it's just knowledge. Now my children will, when they go to their doctors and they're a little older, they will talk about their family history and get tested and be aggressive with their preventative care. So it's very important.
What sort of drove you to do this? Was it your family? Because it is a big decision, right?
It is. I actually have known about my mom being positive for quite some time. And for instance, my mom is a little later in her life and more, she's in her 50s, so she can take more drastic measures. For instance, she had an elective hysterectomy at a very young age to prevent ovarian cancer. She has also started the process of an elective mastectomy, a double mastectomy, which is a huge decision to be made.
Absolutely.
A lot of women fear, oh my God, I'm going to lose my womanhood, and these are my woman parts. But would you rather
either life,
right,
or your breast,
right,
right,
and
they do beautiful
oh my God,
reconstruction
nowadays they do implants, and they tattoos, and they do an amazing job, and this is all covered by insurance if you have insurance. But my decision really turned when I'm almost 30, so I started thinking, all right, usually the cancers start after 30.
Oh, wow.
So
I didn't know that.
yeah.
This test is something that is not that difficult to do, right,
No,
Stephanie?
not at all.
How was it? Is
Very
it a blood
simple.
test?
Very simple. I went to my doctor. I had my annual physical with him. He gave me a questionnaire. I filled it out with my family history. I automatically qualified with my extensive family history and 1 tube of blood and 3 weeks later, and I had my results. And the company that we work with, Myriad, it's great because they supply a lot of support to the patients. Once you test positive, you literally have a genetic counselor at your fingertips. You can call them at any time if you're scared, if you have questions, if you're not sure what you should be doing. They are there to help you throughout the entire process, and it's free of charge.
Yeah. The insurance pretty much
covers it, and if you do not have insurance, it's important to know that this company, the more genetic testing they get, the more advanced they become. So they want our genes, especially the ones with extensive family history. They want your blood, they want your gene. So if you do not have health insurance, you can still come and see us, fill out a requisition with your family history. We send it off. After they review it, they will decide whether if you're a candidate or not, and they will be in touch with the patient and let them know that they would either do it free of charge, or as the most a patient has ever paid out of pocket was $48.
That's great. And I'm going to repeat it, but we do this test here.
Yes.
Stephanie actually works with us. We're very lucky to have her. And she can be a support to you. Absolutely. If you come in and you have some questions. I learned that even if you don't know your family history, if you're an orphan,
right,
or you don't, you're adopted, that this is something that is recommended.
Yes,
right?
This is recommended. If your family history is unknown, there is a section to put unknown, or if you have questions, and the genetic company will distinguish whether you're a candidate or not.
Great. And I am so touched by your willingness to be open, because I think people should be more open about
Absolutely,
this. We're hoping to really save a life, save as many lives as possible, and you can inspire somebody to actually take the action, right, to get tested.
Yeah.
So we're here for you. We're here for our community. We do want to make a difference. We want you to understand the importance of things like the genetic testing, and we will continue to bring you more and more information. We thank you for listening, and we hope that you come visit us. Take care. Thank you. Bye-bye.
Bye-bye.